My name is Dr. Arjun Mohan, and I'm an adult asthma specialist at University of Michigan, focused on helping individuals breathe easier despite their asthma. In this video, I want to talk to you about what asthma is. Asthma is a condition in which a person's airway gets inflamed, by which I mean it becomes red and swollen, often associated with more mucus, making it difficult to breathe at times. Asthma tends to occur more in young boys and adult women, especially in African Americans. It can occur at any age. Asthma tends to run in families and is most likely to happen in people with allergies. Sometimes asthma develops slowly, but other times it can develop suddenly, after having a bad cold, for example. When a person develops asthma, their breathing tubes become too sensitive to the environment. This is because inflammation in the breathing tubes makes them irritated, red, and swollen, as seen here in the breathing tube or the bronchiole on the right. This inflammation can also cause an increase in mucus or phlegm. The main symptom of asthma is shortness of breath. Wheezing and a feeling of chest tightness is also common. Now, wheezing is a high-pitched sound made while breathing when breathing tubes become too narrow or spasm. Chest tightness is when you feel you can't get a full breath in. You may develop a cough, and this cough may have mucus in it. Now, all of this ties back to inflammation in your airways. In people with asthma, symptoms vary from day to day, but the inflammation is there every day. Let's talk about what the airways look like in someone with asthma. Now, Judy had allergies for years, and when she turned 25, she developed asthma. Let's see what her airways looked like before she developed asthma, after she developed asthma, and when she had an asthma attack. The breathing tube on the left of this picture shows Judy's breathing tubes before she developed asthma. You can see that her breathing tubes look normal. They're open and not swollen, and there's no mucus in it. After Judy developed asthma, the breathing tube in the middle shows how her airways have changed. There is now redness and swelling and too much mucus in her breathing tubes. Eventually, she had shortness of breath and cough on most days. Because of this, Judy had to start using a daily inhaler to manage her asthma. Well, not long ago, Judy had an asthma attack the day after she helped her daughter clean up her apartment. For Judy, dust makes her asthma worse. As you can see in the breathing tube on the right of this picture, her airways are now inflamed. They're red and swollen with much more mucus in them. The muscles that wrap around the breathing tubes have tightened, and we call this constriction. All of this caused her to get very short of breath and cough a lot. She followed her asthma action plan to begin treating her asthma by increasing her rescue inhaler use and contacting her doctor's office. Her doctor prescribed her 5 days of prednisone pills to treat her symptoms. I invite you to learn more by viewing our other videos on asthma and treatment.